Hi, I am Dr. Lokesh, Consultant Gastroenterology, Aster Ramesh Hospital. Today I will be discussing about an interesting case of chronic diarrhea with malabsorption. A 60-year-old gentleman, farmer by occupation, presented to us with 6 months history of recurrent epigastric pain, recurrent non-bilious vomiting and diarrhea, along with significant weight loss, about 20 kilos. He was also taking Visalone 10 mg per day and diclofenac 50 mg per day for his knee joint pains. These were over-the-counter drugs. So he was initially seen by nearby doctors. He was treated with multiple antibiotics without any complete relief. When he presented to us, his general physical examination was within normal limits. Systemic examination was unremarkable. Laboratory studies showed HB of 10 grams per deciliter. Rest of the cell counts were normal. Liver function test showed hypoalbuminemia, albumin of 2.4. Other parameters were within normal limits. Thyroid profile was normal. Cortisol was normal. Blood sugars were normal. HIV was negative. IgA anti-TTG was normal. Upper GI endoscopy showed short segment narrowing in D1 D2 junction. Scope could not be passed across. So stricture was dilated through the scope balloon. After the dilatation, multiple biopsies were taken. Colonoscopy till terminal ileum showed normal mucosa. CT enterography showed subtle thickening at the D1 D2 junction. Rest of the small intestine and large intestine was normal. Histopathology from the duodenal stricture biopsy showed Strongyloides stercoralis eggs and larvae. Lamina propria showed mixed inflammatory cell infiltrate with eosinophils. Colonic random biopsies were taken, those were unremarkable. He was started on combination of albendazole with ivermectin, initially given for 2 days, then the course was again repeated after 2 weeks. His symptoms were significantly improved and his epigastric pain diarrhea was subsided and his albumin was improving started slowly. Strongyloides stercoralis is a nematode, lives in proximal small intestine. Infection generally seen in the tropical regions. Majority of people who are immunocompetent, the infection generally doesn't cause any symptoms. But people who are immunosuppressed and especially people who are taking steroids, the infection sometimes can worsen. So people can have this similar presentation like epigastric pain, vomiting, chronic diarrhea, weight loss. Some people can have hyperinfection syndrome, so they can have sepsis and they can die. So majority people, diagnosis of hyperinfection syndrome is very difficult. So we need to be very careful whenever we are prescribing steroids, especially for any indication, especially people who are working in agricultural fields, since the infection rate in these people are high. Empirical treatment with albendazole and ivermectin is warranted. Thank you.